for containing COVID.
Thank you so much, Sabrina. 817, Guam's favorite. We just got a lot of work to do on the phone, so we're going to bring up here. They had asked for this information to be released, and I know a lot of media had also been asking at the press conference for the clinics. There was a public clinic and a private clinic in which patients were infected with COVID-19. I remember it was the governor had said she didn't want to name it. I think there was someone that said it was a need to know thing at one of the press conferences. And so Michelle from the Vigilance Committee. Oh, I might have lost her. Anyway, I got the release, so it's okay. Yeah, so there were 5 healthcare settings where it appears 23 medical workers tested positive for COVID-19. This is according to a response to a FOIA request from the Vigilance Committee. Department of Public Health and Social Services response provided. Michelle, there you are, Michelle. Good morning.
Good morning.
So DPHSS provided you with this response. It was an isolation unit spreadsheet that lists the healthcare settings. First of all, I guess, did you guys think that you were going to get this information so willingly when the media had repeatedly asked for it?
Well, I always give everybody the benefit of the doubt. I always assume that somebody's going to do what they know that they're supposed to do. So, I'm always very hopeful. And luckily it worked out very well. Unlike some people.
Right, and so I know you guys have made requests, but I think this is probably the most, the information you requested that I think would have the most impact on the public really had a right to know. And so in the response that you got from DPHSS, it shows that there was 1 person infected at FHP, 12 at GMH, 2 at GRMC, 6 at Health Services of the Pacific, and 2 at the Seventh-day Adventist Guam Clinic. Let's just go back and tell me how important do you think it is for the people of Guam to know this information, and how offended, if that's the right word, were you that they weren't forthcoming with it?
Well, I was actually very offended because, mostly because, the whole purpose of the committee is to make sure that we get the information out, make sure that everybody, that the government is being transparent. Which, thank goodness, we have the open government law. Thank goodness we have the Sunshine Reform Act. We need to, the whole purpose of this is to protect the public. And when you give information that is pertinent to the health and the well-being and the lives of the public, and part of it is given and another part is not, and you don't even know why. Well, the reason is because, these are private companies. Well, the other companies that you listed were private as well.
Right, and so you're talking about they had named Hafa Bingo, yes. They had named Iglesia Cristo, they had named yes. United Airlines, yes. So it wasn't consistent. I totally agree.
Yeah, and not only that, but people are going into these clinics for various reasons, and not just because they think they have, COVID-19. So if they are exposed to it, they really need to know that, hey, you know what, I was there. I'm starting to develop symptoms. Maybe I don't have any symptoms, but guess what? I have my 91-year-old, father living at home, and I need to take care of him. And I went to this clinic because of whatever reason. These people need to know what's going on. So yeah, I thought it was very. I don't understand why it was so difficult to answer the media. That should have been forthcoming anyway. But regardless, the information came out, and
it was interesting, Michelle, that the Department of Public Health released the FOIA response. Is that how it works?
I'm sorry, say that again.
So was it DPHSS that ended up releasing their FOIA response to your group?
Well, they responded to our group, and they were also the ones that disseminated all the information.
Okay. Yeah.
So we didn't have to release that information because Miss Linda DeNorsi did it herself. So
wow.
I thought that was great.
And then I want to be fair because they didn't name these clinics, and then I think the last time someone had asked about it, Linda DeNorsi had basically said that the issues of exposure were remedied, and that they had run through testing people at all these different clinics and healthcare facilities, and that it kind of, this is an oversimplification what she said, but she was basically like, that ship has sailed already, we dealt with it. She felt there was no longer a risk, and then that was part of why they didn't want to go and name these clinics.
Well, maybe the reason why maybe she changed her mind because she realized that, maybe the public does really need to know they are very interested because they keep asking.
Yeah.
You know, when people keep asking, you got to answer. You know,
Now, I remember this during the press conference when one of the reporters kept on trying to get an answer, and it felt as though Linda was on the verge of releasing the information, and then she deferred it over to the governor, because she was like, unless, Governor, you'd like to, and then it was like, nope, ain't happening. So, but yeah, this list is kind of interesting going through it, especially there's one here that I see, and I want to say this is the particular company that has been contracted to take Menumco that meet a certain criteria. If they don't have transportation, if they don't have a means to go grocery shopping, then they can pick you up and they can take you. If this is the same company, so I think we need to make some phone calls.
Yeah.
Well, see, and there you go. See, that just proves the point why we need to know all this information.
And it also kind of proves the point why they didn't want to tell us, because people are going to freak.
Yeah.
Well, people are kind of already freaking out.
Right. No.
So, you know, and I mean, I think that this actually brings more of a peace of mind in a sense, like, okay, now I know I've been exposed. Now I know this is the situation. Now where do I go from there, instead of wondering? You know, because I've spoken to people, it's like, I just went to a clinic with a friend. My friend, she was the one that was sick. I didn't, I heard somebody cough. I left right away. Is this one of the clinics? And, now that spreads some chaos that doesn't need to be there. So now we have some answers. Now we can move forward with what needs to be done.
Right, and we hope this is a trend, because there are things that we keep asking about, and then we keep getting the same answer or the same non-answer. So I just wanted to bring you on, Michelle, and kind of show people that there's people out here fighting battles for transparency, and in some cases they're winning them. So.
In some cases, in some cases not so much.
Yeah.
Like if you remember the last phone conversation we had with the FOIA regarding the transparency with the governor.
Right, it's been kind of lacking.
Daniela Carrera.
Right.
It's been very lacking.
Right.
So that's been very disappointing, considering the fact that the information that I got was basically stuff I could have downloaded myself, and not only that, but I had to pay $1.58 to get that information when I could have just gotten it for free. But that's neither here nor there.
Anyway.
So we're going to continue on with that.
Yeah. So thank you, Michelle. Thanks for coming on and sharing that with us. Okay.
Okay.
Thank
so
you.
Appreciate it.
Be safe.
much. Okay.
All right. Wash your hands.
Will do.
Okay. That's Michelle from the Vigilance Committee. Yeah, good job. I'm glad that we were able to release that. And, I felt like Linda wanted to put it out. I mean, we really asked her a lot. She called the show, and she fell on her sword. She said it was my decision to not tell people, and she kind of stuck with it. Man, now that's done.
I want to read through this.
I know. Bree's got some reading to do. I'm going to take a little break. We're going to go to Mungitown and speak with Mayor Alan Ugata, and then we've also got the Republican Party